Ebola virus disease, or EVD, is a serious illness. It can be deadly. The disease is caused by the Ebola virus, which is part of the Filoviridae family. This virus is highly infectious and can spread rapidly, especially in areas with limited healthcare infrastructure. EVD was previously called Ebola Hemorrhagic Fever. This name reflects the severe bleeding that can occur in patients, both internally and externally. The disease is known for its high fatality rates, which can range from 25% to 90% depending on the outbreak and the quality of medical care available. The disease was first discovered in 1976. It was identified during two simultaneous outbreaks in Sudan and the Democratic Republic of Congo. The outbreak in Congo occurred in a village near the Ebola River, which is how the disease got its name. It was found near the Ebola River in Africa. This remote location made it difficult to control the initial outbreak, and the virus spread quickly among the local population. The isolation of the area also meant that medical resources were scarce, complicating efforts to treat and contain the disease. Since then, there have been outbreaks of EVD. These outbreaks have varied in size and severity, but they have all posed significant challenges to public health officials. The largest and most devastating outbreak occurred between 2014 and 2016 in West Africa, affecting countries like Guinea, Liberia, and Sierra Leone. Most outbreaks happen in Africa. The virus thrives in tropical regions where it is believed to be carried by fruit bats. These bats can transmit the virus to other animals, such as monkeys and apes, which can then pass it on to humans through direct contact with their blood, secretions, organs, or other bodily fluids. EVD is a hemorrhagic fever. This means it can cause bleeding inside and outside the body. Symptoms often start with a sudden fever, intense weakness, muscle pain, and a sore throat. As the disease progresses, it can lead to vomiting, diarrhea, rash, and impaired kidney and liver function. This means it can cause bleeding inside and outside the body. In severe cases, patients may experience internal and external bleeding, such as oozing from the gums or blood in the stools. This bleeding is a result of the virus attacking the body's blood vessels and immune system. The virus attacks the body's immune system. It damages blood vessels. This damage can lead to severe bleeding and organ failure. The body's inability to mount an effective immune response makes it difficult to fight off the infection, leading to high mortality rates. This damage can lead to severe bleeding. Patients with severe EVD often require intensive care, including rehydration with oral or intravenous fluids. However, even with the best supportive care, the prognosis for patients with severe EVD remains poor. EVD is a public health concern. The World Health Organization and other international health agencies work tirelessly to monitor and respond to outbreaks. Rapid response teams are deployed to affected areas to provide medical care, conduct contact tracing, and implement measures to prevent further spread. It is important to understand the disease. Education and awareness are crucial in preventing and controlling outbreaks. Healthcare workers receive specialized training to handle EVD cases safely and effectively, minimizing the risk of transmission. Knowing the symptoms and how it spreads can help with early detection. Early detection is vital for isolating patients and providing them with the necessary care. It also helps in identifying and monitoring people who have been in contact with infected individuals. Early detection is key to controlling outbreaks. Rapid diagnostic tests have been developed to quickly identify the presence of the Ebola virus in patients. These tests are essential for initiating timely treatment and implementing quarantine measures to prevent further transmission. Ebola outbreaks can be scary. The fear and stigma associated with the disease can lead to panic and social disruption. Public health campaigns aim to provide accurate information and reassure communities that with proper precautions, the spread of the virus can be controlled. But knowledge and preparedness are our best defenses. Communities that are well informed about EVD are better equipped to take preventive measures, such as avoiding contact with infected individuals and practicing good hygiene. By understanding EVD, we can work together to prevent and control its spread. Collaboration between governments, health organizations, and communities is essential in the fight against Ebola. Through education, early detection, and rapid response, we can reduce the impact of this deadly disease and save lives. Ebola virus disease is caused by a virus. The virus is called Ebola virus. There are different species of Ebola virus. These include Zaire Ebola virus, Sudan Ebola virus, Bundibugyo Ebola virus, Thai forest Ebola virus, and Reston Ebola virus, though this one does not make people sick. each species of Ebola virus can cause EVD. The Zaire Ebola virus is the deadliest. It is responsible for most outbreaks. Scientists are still learning about Ebola virus. Understanding the virus helps us develop treatments and vaccines. These are important tools in the fight against EVD. Ebola virus spreads through direct contact. This means touching the bodily fluids of an infected person. These fluids include blood, vomit, diarrhea, saliva, sweat, urine, and semen. You can also get infected by touching objects contaminated with the virus. These objects might include needles, clothing, and bedding. Ebola virus does not spread through the air like the flu. It needs direct contact to spread. Understanding how Ebola spreads is crucial for prevention. Avoiding contact with infected fluids is the most effective way to stay safe. Ebola virus disease has a range of symptoms. Symptoms usually appear within 2 to 21 days after infection. Early symptoms of EVD can be like the flu. These early symptoms include fever, headache, muscle pain, fatigue, and sore throat. As the illness gets worse, more serious symptoms appear. These can include vomiting, diarrhea, rash, stomach pain, and bleeding, both internal and external. It is important to seek medical help immediately if you have these symptoms and have been in contact with someone who has EVD or has traveled to an area with an outbreak. Section 5. Diagnosing Ebola virus disease. Diagnosing EVD quickly is important. It helps to stop the spread of the disease. Doctors use laboratory tests to diagnose EVD. These tests look for the virus in bodily fluids. The most common tests are polymerase chain reaction, or PCR. This test detects the virus's genetic material, RNA, enzyme-linked immunosorbent assay, or ELISA. This test detects antibodies the body makes against the virus. Early diagnosis helps healthcare workers provide the right care. It also allows for quicker isolation of infected individuals to prevent further transmission. Section 6. Treatment and management. There is no cure for EVD or Ebola virus disease, which makes it a particularly challenging illness to manage. However, there are treatments that can help people survive. These treatments are crucial in managing the symptoms and improving the chances of recovery for those affected. Treatment focuses on supportive care, which is essential in helping the body fight off the virus. Supportive care includes a range of medical interventions that aim to stabilize the patient and alleviate symptoms. This includes providing fluids, electrolytes, and oxygen. These elements are vital in maintaining the body's essential functions and preventing complications that can arise from dehydration and organ failure. It also involves treating symptoms like fever, vomiting, and diarrhea. These symptoms can be severe and require constant monitoring and intervention. Antiviral medications. There are now FDA-approved antiviral drugs that can be used to treat EVD. These medications represent a significant advancement in the fight against Ebola. These medications work by stopping the virus from replicating in the body. By inhibiting the virus's ability to multiply, these drugs help to reduce the viral load and give the immune system a better chance to combat the infection. Two of these medications are Inmazeb and Ibanga. Both have shown promise in clinical trials and have been approved for use in treating Ebola patients. These medications have been shown to improve survival rates for EVD. Patients receiving these treatments have a better chance of recovery compared to those who do not. While treatment options are improving, it is important to note that early intervention is key. The sooner a patient receives medical care, the better their chances of survival. Prevention remains the most effective way to combat EVD. This includes measures such as vaccination, public health education, and practicing good hygiene. By preventing the spread of the virus, we can reduce the number of cases and ultimately save lives. Section 7. Preventing Ebola outbreaks. Preventing EVD outbreaks involves several strategies. These include avoiding contact with infected people. This includes avoiding direct contact with bodily fluids and contaminated materials. Practicing good hygiene. Washing hands frequently with soap and water or using alcohol-based hand sanitizers is crucial. Vaccination. There is an effective vaccine called RVSV-Zebov. It protects against the Zaire Ebola virus species, the most common cause of outbreaks. Public health measures like surveillance, contact tracing, and isolation of suspected cases are also essential for preventing the spread of EVD. Section 8. The 2014 West Africa Ebola outbreak. The world's largest Ebola outbreak happened in 2014. This outbreak was unprecedented in its scale and severity, capturing global attention and causing widespread panic. The virus, which had previously been confined to smaller, more isolated outbreaks, suddenly became a global health emergency. It started in West Africa and spread to several countries. The initial cases were reported in Guinea, but the virus quickly crossed borders, reaching Liberia and Sierra Leone. The rapid spread was facilitated by the movement of people across porous borders and the lack of early detection and containment measures. The outbreak affected Guinea, Liberia, and Sierra Leone the most. These countries faced the brunt of the epidemic, with thousands of cases and deaths reported. The healthcare infrastructure in these nations was ill-equipped to handle such a massive health crisis, leading to a catastrophic situation. The outbreak overwhelmed healthcare systems. Hospitals were flooded with patients, and there was a severe shortage of medical supplies and protective gear. Healthcare workers, often working in extremely challenging conditions, were at high risk of infection themselves. It caused many deaths and had a huge impact on these countries. Beyond the immediate health crisis, the outbreak had profound social and economic consequences. Communities were devastated, economies were disrupted, and the social fabric of the affected regions was torn apart. The global community responded to the outbreak. International aid poured in, with countries and organizations around the world sending resources, medical personnel, and financial support to help combat the virus. Organizations like the World Health Organization (WHO) and Doctors Without Borders provided aid. These organizations played a crucial role in coordinating the response, setting up treatment centers, and implementing control measures to contain the spread of the virus. They helped set up treatment centers and implement control measures. Quarantine zones were established to isolate infected individuals, and extensive contact tracing efforts were undertaken to identify and monitor those who had been exposed to the virus. The 2014 outbreak highlighted the devastating impact of EVD. Survivors shared harrowing stories of loss and survival, and the sight of empty streets and closed businesses underscored the profound disruption caused by the epidemic. It emphasized the need for strong health systems and a coordinated global response to contain outbreaks effectively. The lessons learned from the 2014 outbreak have informed global health strategies, underscoring the importance of preparedness, rapid response, and international collaboration in the face of emerging infectious diseases. Section 9. Ebola, a zoonotic threat. Ebola is a zoonotic disease. This means it can spread from animals to humans. Bats are considered the natural reservoir of the Ebola virus. The virus can spread to humans through contact with infected animals. This can happen through hunting, butchering, and eating bushmeat. Once the virus jumps from animals to humans, it can spread rapidly through human-to-human transmission. Understanding the zoonotic nature of EVD is critical for prevention. Avoiding contact with bats and other potential animal carriers is essential to reduce the risk of future outbreaks.